so now I'd like to call up this for the evening, Mr. Scott Huennekens. He is our guest of honor tonight, former CEO of Volcano Corp. And now CEO of Verb Surgical.
Hey.
Welcome, everyone. So now that I've plied you with drink and
exactly,
food,
I definitely feel 10 years older, not 5 years older. Activist shareholders will do that to you.
Yeah. So this hotel, you told me tonight, held some special place in your heart. You want to share with the group why? Get them on your side quick.
Yeah, no, 27 years, 4 months ago, I got married here. So it was, it was definitely a hipper, cooler place. It was the Meridian, you know.
Oh, yeah.
Half the people spoke French. It had a cool vibe. No, my wife dropped me off tonight. She's out with her high school girlfriends. We live in San Diego. She drove up. But we went out back to the gazebo and took our picture. She looks a lot closer to what she looked like 27 years ago than I do. So, yeah.
Well, that's awesome. I love that. These are those little coincidences that happen with this event that just like, I love them. I love them. And so let's talk about Verb Surgical, because I think it touches on so many things that fascinate us. You know, first, it's the collaboration between Google and Johnson & Johnson, and it deals with robotic surgery. So it's like it's hitting all these awesome buzzwords. And you know, in our discussion, we talked about one of the premises of that Verb Surgical is built upon is that there are something like, I think it's 133 million surgeries a year globally that don't happen because of lack of access to surgery. And talk me through that premise a little, because robotic surgery makes up, 5% of all surgeries, and you know, the leader in robotic surgery is Intuitive Surgical right now, and you know, I would not call that a low-cost provider by any stretch. So what do you see in this 133 million projected surgeries a year that don't happen?
So leaving Volcano, having a big success, I plan to take a couple of years off, enjoy myself, and then I got a call from the guys at JNJ, Gary Pruden and Alex Skorsky, the CEO there. J&J DC had funded Digirad and also Volcano as investors, and said, hey, we want to create this new company to change the future of surgery. And I really wasn't interested, but I said, I'll go up there and just take a look. Hey, who doesn't want a free, lunch, right, at the Google campus and get a ride around on a bike and can even get a haircut for free, for crying out loud. So I went up, and the thing about Google that really got me excited, they have more money than God, was that, they have these moonshots where they want to make a big difference. And so when you look at this and you say there are 8 billion people on Earth and only 3 billion have access to surgery, that's incredible. I didn't appreciate that, and that you could be part of something. It's temporal in nature. It may take 20 or 30 years, but you could kickstart a process to build a platform that could grow into giving access to surgery for those other 5 billion people. Was, it still sends shivers up my spine, like to have the opportunity to get to make that difference in the world by creating a platform that could include robotics and then machine learning and data analytics. It was awe-inspiring and super exciting, for me, and made me, say, all right, I'm done with Africa vacations and golf in Scotland. I gotta, this is more important.
So when they started the company, they told you, you're not going to have to worry about capital, you're not going to have to worry about funding, you're going to have to worry about changing the world. Personally, that proposition might make me a little bit nervous.
I know what it feels like to be one of my kids now. You got these really two wealthy parents who are very demanding, and you have no reason to fail. I mean, none. I mean, they're 2 of the 7 largest market cap companies in the world. You got all this Google technology. J&J is the largest med tech company. If you think about, you and I talked about it, we're on the fringe of this next MedTech 3.0 era, where kind of 1.0 was this industrial space. You made devices, then 2.0, you made devices with some microelectronics and some digital, but mainly analog. Now we're at 3.0, where you have smart devices with machine learning capabilities, connectivity, data. All this stuff is free with computing power, and arguably J&J is the biggest and the best at MedTech 2.0. Google's the best at information technology. You put them together, that's super exciting and intriguing about being able to change the world.
Most definitely, but I mean, how do you, I mean, doesn't it?
And here's $400 million to go do it. Not have to worry about financing but it's a $10 to $20 billion opportunity with all of Google's technologies, J&J's, putting them together to go make this happen.
But how do you not look at it like boiling the ocean? I mean, how do you break that down? How do you change the world? How do you start that first step?
Well, I mean, anyone here run a marathon? Anyone? So, hey, two people. And how'd you run the marathon? Huh? How'd you run the marathon? One step at three. That was my Medtronic friend. One step at a time, right? You got to train, you got to prepare, and do it. So, similar here. This is something that will take time. There's going to be stages of introductions of products that will have, first generation technology, second generation, third generation, where there's going to be actionable information, then semi-autonomous information, then autonomous capabilities built into a product over time. But you got to get started, and you got to put that platform out there to collect the data, to do the things you need to do with machine learning.
I mean, I would imagine this is a much different sort of challenge than the other startups you've worked at, in terms of, you were employee number one here, right?
Yep.
So like employee number one, you walk in, you put the picture of the family on the desk.
There are no desks.
You sit on your ergonomically correct.
You get a ball. And you get a little,
space in the middle of the room.
It's funny,
seriously, how do you even begin to start carving this out? I mean, like, because I'm trying to get to like, what, in as much as you can share, what will the products that you create look like, or is it a product? Is it a?
Yeah, so we think in terms of a platform. We think, in the worlds of surgery, there was open surgery, that was surgery 1.0. Then there was laparoscopic surgery 2.0, robotic surgery 3.0. We think in terms of this new era of digital surgery, what we call surgery 4.0, that a number of key opinion leaders have talked about, and we've adopted that language, which is to say that robotics is a tool. It'll be used on open surgeries, laparoscopic surgeries, data analytics and machine learning, again, working on open and laparoscopic procedures as a tool. But that's again evolutionary as you take place. So the product that we'll have, we're not a robotics company, we're a platform company. There'll be robotics, which are a key element, advanced instrumentation, advanced visualization, data analytics and machine learning. You've heard of things like Google Brain, TensorFlow, DeepMind that beat Go, and connectivity. All of these robots, just like every Google driverless car is connected, and all the data goes up. You have learning that comes back to the device. All of our devices will be connected. But generation 1 is going to have a level of information different from 2 years out, 4 years out, relative to its capability. So there's generational iterative process that's going to go into this. Just like a Tesla car. Every Tesla car. I was at a meeting a couple of months ago, and it's kind of a knock on Google, but the Google guy got up and said, hey, over the last 2 or 3 years, we've got 1 million miles on these cars on self-driving. The next speaker was Tesla, and the guy got up and said, we've got 1 million miles in the last week. The last week. I mean, by putting the technology in all of their cars, every car, I have one, it goes up, gets sent back down, They're collecting all that data, which you can have better algorithms. They got more data. It's all about the data, which is incredible relative to a connected platform in learning. And I think that's going to happen across medtech over the next 10 to 15 years, whether it's with Google and things that will happen there, or IBM Watson that Medtronic is working with on their platform. It's all good for patients and what's going to happen around the world.
But I mean, Tesla's a car, and that's very tangible. But I mean, sort of what you're talking about, the value prop of Tesla is that it's this sort of group hive thinking automobile that works on the power of the collective. I mean, is that sort of similar to what you're envisioning as a product? I mean,
so what we're envisioning as a product is, today I would compare it to a mainframe computer, the Intuitive system. Intuitive, great company, incredible what they've created. I mean, heck, we'd all be proud, super proud. $3 billion in revenue, $27 billion market cap. But like mainframe computers, they had a hard time transitioning to minis, to PCs, to cell phones. And really only one company transitioned from even PCs to phones. That was Apple. Everybody else, it's taken a different company to disrupt and create that new platform. I look at what we're doing, what Medtronic's doing, as moving from mainframes to PCs, where robotics and those platforms will be always there, always on, like a PC on every desktop. Every OR will have one. Back to my Volcano days, we said we need to put our system in every single interventional cardiology cath lab. 5 years later, we had 8,000 installed systems. Between us and Boston, we were in every single cath lab. We had 80% of the installed base because we said, hey, we're going to have an open platform with all of these apps. Similarly, it's our intention to be open platform, have multiple apps. So we put in this platform that allows it to be always there, always on, available to help you as the surgeon do surgery. If that's one portion of the procedure, it's the entire procedure. We're indifferent. If that's just using an advanced instrument from J&J on it, if it's the advanced visualization, because now we have machine learning on visualization to help you identify a ureter or a nerve, et cetera, or if it's the segmentation, because we can track through your procedure, the steps relative to simulation and training, all of those are going to be part of a total solution. The product is no longer robotics. The product is, robotics, the advanced instruments, the visualization, machine learning, the connectivity. Back to like when I was at Volcano, we were competing with Boston, and Boston would say, well, we have a little better IVUS catheter. And I was like, it doesn't matter. We have two kinds of IVUS catheters: coronary, peripheral, pressure wires, flow wires. That's the product. Like, who cared if Lotus 123 was a little better than Excel? It didn't matter. The product was Microsoft Office. You had to have PowerPoint, Word, the Internet Explorer. The whole thing was the product. Now, at the same time, you can't be the copier, printer, fax. It's a shitty copier, a shitty phone, a shitty, we've all been there. I mean, it's got to be, best in class in each of those segments. So I don't know if that answers your question about the product.
No, it does.
But it's a platform that, the vision is it's in every OR. Every single one of them is connected to the cloud. We have a whole suite of products at Google Cloud, YouTube for organizing all the videos, 3 different machine learning algorithms with TensorFlow, Google Brain, and DeepMind, AR, VR, all their gaming stuff, both Android and Chrome from an operating system, all the cybersecurity. You go, if you're another company trying to replicate that, you got to go to 7 or 8 different vendors. I tried to create an operating system for Volcano when we switched from being a single app to multiple app. It took 4 years and $30 million, and all these engineers who were good but not great. Like, I wireframe this product solution. 2 months later, you have full access to all of their software, and you have a fully working prototype.
And the business model in terms of how, I assume this is going to still be pretty normal standard business model, or are you looking at something more innovative in the way that Google sort of learned how to, what did you say, they skimmed 2% off the world's economy?
Yeah, no, I said, yeah, Google is the most incredible business ever, right?
Right.
I mean, you have a monopoly on skimming 2 to 3% off of the world economy. I mean, that's pretty good. I mean, right?
Pretty good.
I mean, Larry Page and Sergey Brin are did well for themselves.
Yeah, they're smart guys.
Smart guys. But no, I mean, the opportunity we have is to have two businesses in the sense of one is the surgical business, the other one is all those Google technologies that I mentioned, where there's 8 or 9 of them that it could apply not only to us, but can be a solution to if you're an EP company, if you're a cardiac surgery company, if you're a visualization company, if you're a orthopedic company. The same things apply where you're going to want all of these devices. I don't know if you're ResMed with sleep apnea, if you're a Pyxis, pill dispensing machine. I mean, you want that connectivity to the cloud, learn all this data, get this machine learning and benefit that you can push down, but also giving, like you all get all these benefits, whether you're on Twitter or Facebook or Instagram or whatever, where you're not paying for anything, but you're getting benefit, but they're getting benefit, by being able to advertise you, get all of your data. There's an opportunity for another business to collect and have all that. IBM Watson's pursuing that aggressively, and Google's now setting that up more on pharma and biotech to do the same.
I've heard often that surgeons are more like artists than art engineers. Do you think they kind of bristle at the notion that they need more uniformity, or they need more assistance, or the help of a machine learning algorithm or something like that?
Yeah, our experience, we've had well over 100 surgeons visit us in the last year, all of the key opinion leaders from around the world, and they are super excited about what's going to happen and how surgery is going to change over the next 5 years. I mean, look, they can now understand better what they're doing, and they can also will have a platform for sharing that throughout the world to help educate people around the world to do surgery better. So I think they all recognize they can get better, and they want to follow that person. They want to share with that person. This allows you to collaborate, to understand, and when you're a surgeon, you're sitting at the bottom of this triangle in your local hospital, and you have your fellows, you have your people in your program. Your circle of getting information is pretty limited versus all of us where we're using the internet and I'm sitting in my home and I'm, last night I'm, saying, okay, Google, what's the magic word? All the different things you can learn and get. The surgeon doesn't have that access in the OR. They can't pull in videos. They can't do pre-procedural planning. They can't simulate the case and do it. All these things they want to have because they want to deliver great. They went into healthcare, they went into being a surgeon to do remarkable things. And so our goal is to give them that actionable information and those tools to be great every single day. So there's not a lot to argue with about that. And it's flexible, it's optionable. Hey, you do this procedure, these 17 steps, that's fine. This guy does them 15. Here, you can now start seeing your 17 steps versus his 15 or hers and look at those differences and outcomes because you're following them and you're sharing. If you want to, it's all open or closed. It's just like anything else. You can have the privacy that you want, or you can share if you want.
Is this what you mean by like the democratization or democratizing surgery? I read that.
Yeah, no, our goal is to democratize surgery. And what we mean by that is again, solving for those 5 billion people that don't have access to surgery.
Right.
It's 30 years from now. You have machine learning, you have data analytics, you have robotic systems that are smaller, cheaper. They can be everywhere. And you can do surgery, locally, remotely. You can divide up the manufacturing process so that they're doing those 10 or 15 minutes that are super complicated. Other people that are less skilled are doing other portions of it. Again, that's not for today, that's not for tomorrow, but you could see as you develop the platform where you could go to deliver healthcare everywhere in the world for people.
So you said you're really excited about machine learning and its impact on med tech. I saw you said that at the Cleveland Clinic. Are you a techie? I mean, are you a guy who's an early adopter of tech? Are you a sci-fi fan? I mean, tell me what kind of like got you
No,
juiced up about this?
I was definitely not the kid watching Star Trek or Star Wars. I was watching, the Angels here locally lose a lot as a kid growing up. Over time, I definitely have fell in love with technology and med tech and the opportunity to change the world, with it. I've had the privilege to get to work in this industry like the rest of you on everything from artificial hearts at Edwards to heart valves to bypass surgery and then minimally invasive surgery and non-invasive imaging to find heart attack. And you feel a privilege, but also an obligation once you've been in that position to make stuff happen. You've joked with me. I send all my emails, go, go, go.
Yeah.
There's power in action. That's part of the reason we named the company Verb. We want to take action. It's kind of a force equation relative to what's possible. Let's try and make everything that's possible in our lifetime happen.
Yeah.
And shame on us if we don't. So, I think, technology offers a lot of potential. We got to manage it. I mean, I wouldn't be that afraid of like the singularity is near, like being at Google and seeing really where we are with machine learning. We don't have a lot to worry about in the short term, in the next 20, 30, 40 years. But there's a lot of benefit that I think that we can incorporate into devices to figure things out. Cheaper, faster, better.
So you're not a sci-fi fan, so my question, does the future of medicine look more like the robot doctors of Empire Strikes Back or the tricorder of Star Trek? Wouldn't be...
I actually have the tricorder, and I actually have their scanning surgical machine is in my presentation decks because I think they're, we're within 50 years of some of those capabilities based upon, look at like what a company like HeartFlow is doing, right down with non-invasive CT imaging to tell you, what to treat, not to treat, in the cloud, and then you can envision robotics with Corindus doing, stenting without angiography. And, it's almost like, processing a CNC machine to go do things. And I think we'll have steps like that can happen in surgery as well.
But like in 50 years, do you think the future looks more like a robot is operating on you, or is it a person with a robotic device that is giving you?
I think a robot's operating on you.
Yeah.
In 50 years,
Yeah.
If you can look, if you play out the continued acceleration of technology, and Moore's law goes, to 3 years, even 4 years. Computing power every 10 years, I think the number is something like it's 10,000 times greater. 10,000 times 10 years? Yeah. 5 times over a 50-year period. And what can be learned and the computing power at that point in time, there's a rapid acceleration that will take place. So I think there's a surge in there that's guiding things, but you're going to have advanced algorithms that will tell you all of your imaging information. If you want to suture, it's going to be able to suture much better than a human can. The combination of the two working together is definitely the future.
And I kind of I'm skipping ahead a little bit because it does bring me to something like, I read Stephen Hawking recently say, that we've seen a lot of sort of monumental changes in terms of the voting patterns of, Brexit and our recent election and some of the other more sort of surprising results. And he said, really, that is sort of the vocalization of the masses about the concerns about their economic consequences of globalization and accelerating technologies. And he said the automation of factories has already decimated jobs in the traditional manufacturing and the rise of artificial intelligence is likely to extend this job destruction deep into the middle class, with only the most caring, creative, or supervisory roles remaining. So, I mean, since we're looking at this 50 years from the future, I mean, do you think that's something that you guys have to take into account? Will there be a backlash against the robot?
I don't think that's something in the next 10 or 15 or 20 years.
Yeah, I'm talking about the 50-year kind of.
If it's 50 years, no, I definitely think it's something that society will at some point need to start being concerned about and worried about. I don't, Tom Friedman has his new book out. There's a great line in there, the factory of the future will have one person and a dog, and the line was something around, the dog is just there to bark at the human or for the human to feed the dog, or, the human doesn't have a job. It's like the dog has the job. I mean,
right.
Yeah, we're headed to places like that. I'm not knowledgeable enough to think about all the implications and the ins and outs. Also in Friedman's book, he's talked about in all these areas where there's been automation, everything from an ATM, to the airline industry, there end up being more jobs than there were before in those industries, because the cost of them becomes so much lower.
Yeah.
They become accessible to so many more people. So again, it's temporal in nature, where you're going to go through those phases. Hey, maybe the future is we only all have to work 10 hours a week, and there's robots doing all this stuff, and we can have the aristocratic lifestyles of pleasure. I don't know, and leisure.
Or like in the Jetsons.
Or
eat a pill.
you can also go to the Terminator, and there's, the people who are controlling the power, and there's 90% of the people who don't, and so that's,
all right. So we're hanging out at the beach, working 10
hanging
hours
on
a
the
week,
beach,
or
we're
running
running away from robots. Those are your choices. I'll choose the beach.
Yeah. I kind of just wanted to go there because, we're talking about these very big concepts, but I think it is something that is becoming more, and I don't think people think about the fact that healthcare might be on one of these, but healthcare is an obvious place where robots should, we're going to run out of the amount of caretakers that we have for the aging population.
I was watching, a CNN program yesterday, Fareed's show, whatever he always says his name. And, in Japan, I think it's 40% of their population will be over 65 in 20 years. And they don't have enough caregivers. And it's like robots are being developed to help solve that problem. Astro Teller, the Google guy who runs X, he has this great graph where it's humans can only adapt at this rate. That's the kind of the proven adaptation curve, and technology is doing this. And so there's a gap between the technology curve is accelerating too fast versus the humans. And it's not just humans, it's governments as well, right? So if you look at Uber, Airbnb, they're stuck because their technology is above the human and the government adaptation curve,
right.
And you got to solve for that. So we, as an industry, whether it's AVMed, MDMA, all of us, I think we need to be pushing so that we can get that government adaptation curve to be faster, so that we can force, data anonymized to be available, so we can have solutions versus being limited. So it's not 20 or 30 years like Epic and Cerner, open their platforms up to have data accessibility, or HIPAA laws with anonymization are adapted so that you can get data as a vendor to nothing to do with a person, but figure out solutions to help people, because people want those solutions to happen. So we got to get that curve to go up, and we as the United States have become, in my view, more risk adverse. Other countries like China are just going to say, screw it, we're moving the curve to this rate because we're going to make a totalitarian decision, and they're doing it in genomics right now, right? So we're going to fall behind because you can't do research that you can do other places in the world. You're going to have to get that curve up. Now, 21st century curves, I think, was a good step last week. AdvaMed and MDMA and others have worked passionately to get that moving forward, and it addresses moving that curve up so that it can be more equal to the technology acceleration curve.
Let's take a step back here and
Not
look.
to bore you all, but
No, it's.
get excited about this stuff.
I would imagine people are a little more excited about talking to you about your work now that you get to say, I'm running Verb Surgical and I'm doing this Google JNJ thing. I mean, do you find people are more interested in that than say they were in Volcano? Or although Volcano was a really awesome name.
Yeah, it was a great name. I mean, who doesn't want to put a catheter in your heart called Volcano? I mean, that was great branding, right? I mean, no one. But hey, when you think of Apple, you don't think of an apple you eat, right?
Right.
So no, there's definitely a lot more interest. I mean, look, we had a big vision at Volcano, which was to solve heart attacks, and we made a lot of progress. We did the first natural history study published in the New England Journal of Medicine, Prospect, 3,000 plus patients. That data is getting used by HeartFlow and Philips and others. Now with some machine learning, there's signals there to help figure out which plaques are likely to progress and cause heart attacks. We were the surrogate endpoints on all of the major statin lowering drugs for 10 years that helped get all those approved. So, hey, we made a huge impact. But hey, there is something that's a different level of sexy around Google, J&J, robotics, machine learning, this next 50 years question, how you can change things that is impactful.
It must be fun for you. I mean, like, to be there in this place that now everybody thinks is synonymous with world-changing innovation. And you told me you're a startup guy, you've been in startups for 20 years, and now you're working right next door, right, to where they founded Google. Your offices are right next door, right, or in the same building or something like that. And
2400 Bayshore was their first office, and their second office was 2450. So we're in 2450. It's pretty weird. Like 15 years ago, Larry Page and Sergey Brin were there as two PhD guys with this little company, Google, which is now the largest market cap company in the world. That's crazy.
Yeah.
It's crazy to think about, 15 years ago.
I know.
They were, on rollerblades cruising around in there, talking about how they were going to do search better. I mean, they had no idea how big the impact could be. But that's often the case. Like, a lot of you guys are startup people. That's often the case. I mean, you start, you adapt, you change, the vision gets bigger and it becomes bigger. You're in the game and you see things and new opportunities are created by being there and being open to making those changes. I've been involved in 10 startups. 9 out of 10 of those, ended up doing something entirely different than what we really started out to do.
But did you start out with that massive idea, though? I mean, you said you started out to stop heart attacks. I mean, that's pretty big.
And then we didn't do it.
Yeah, you narrowed
we still created a company with almost a $2 billion market cap.
Yeah.
We changed, we adapt. We created color television, for intravascular ultrasound, and won that market. At the same time, we're continuing to progress on the heart attack side of things, and went into pressure and flow, and then into therapies and combining them. I mean, if we were stuck to being a diagnostic for heart attacks and then try and prove it with therapy-wise, we would have died. Yeah. Because we had 3 things: thermography, near-infrared, and virtual histology. None of them had a good enough signal at the time, and/or the time to prove it and then prove the therapy would have been 10 years and $100 million, and we wouldn't have been able to raise the money or make it work.
So, I mean, is Google's success replicable, do you think?
Their success...
Is it replicable? I mean, are you guys out to make another Google, or are you out to just create the best medical device?
Look, there's not enough surgery to skim 2% off the world economy. That equation isn't replicable. I mean, that's a once in a lifetime kind of thing. But I think we can have an impact on back to the 133 million people who need surgery who don't have it. Arguably, that has a greater social impact than being able to search for the information. Well, I don't know. The information and knowledge has created so much. It's not fair to make that comparison. They're both very important endeavors.
I just wonder, though, is the ecosystem different just because you're there in this really fertile environment? I mean, are you, in terms of your startup, does it feel like a typical startup, or do you feel like, I mean, you're not, because you have a $400 million startup, but I mean, what's the difference between a $25 million startup and a $400 million startup?
It's very different. I mean, at Digirad and at Volcano, or CVI, or these other things that I've been involved in, there were no free lunches, no free haircuts, no free laundry. Those things didn't exist. I mean, but I think it's important to recognize that. So I still fly up there on Southwest. I still get the cheapest rental car I can get with, like, if they have the ones with the roll downs versus electric, I'm like, yeah. I want that one. Just to set the example of, we're not going to waste money. We're a startup. We need to be focused on what's important. The patient is important. So we draw our organization chart upside down. I'm at the bottom. Patients and physicians are at the top. And that's our focus. Again, back to that word privilege. We have a privilege to get to work in this industry, solve these problems. We don't want to waste capital. And I think, there are a number of these moonshots at Google that have not worked out. We will not be one of them. We're very disciplined, very focused on delivering, and have executed accordingly. And part of that is we've got a team that's done a number of startups before and done them successfully, coupled with an Ethicon that's a world leader in surgical instruments, and Google on the technology. So we kind of have the best of all worlds. No financing risk. It's all 510K products, so there's not regulatory risk. There's not real technology risk. Technology is more temporal, over time and what gets executed, and they're all 510K. So it doesn't have maybe some of the risks that a lot of other startups that I've been involved in that had financing risk, regulatory risk, technical risk, and market adoption risk. That's kind of why I liked it as well. I didn't feel like, when I left Volcano, I said, I will never do a startup from the beginning again. Then, 7 months later, I was employee number one, but it was different. Those 4 risks that I talked about were mitigated to retired.
Yeah. I'd imagine that $400 million's tranched, right? I mean, that's not just like an ATM. Like, I would love to look at that balance. I think that would be so cool. Let's go back just to, are there things you did at Volcano that you absolutely don't want to have to experience again? Are there things that you definitely would replicate in terms of maybe moves that you made, or perhaps mistakes that you made that you want to learn from?
Yeah, no, I would say the Mary Lynn Gaddis is here, who I've worked with at Baxter, Digirad, Volcano, and she's our chief culture officer and doer of all. So, like her big main mission is, we got to replicate the culture we've had at each of these companies, where it's foundational to build great cultures that attract the best people so they can do great things and be happy, in their work environment. So we've done that I was lucky enough to get to work at Baxter, at Edwards under Mike Masalem, and he had that culture aspect, and then we did it at Digirad, did it at Volcano. We're doing it at Verb, and then get the best people, have the systems and processes. The other thing, I told you we drew our organization charts upside down. The other thing is we have no policies. We except one, which is do the right thing. So I felt like at a certain point we got too process oriented at Volcano too early. Mm-hmm. You have the entrepreneurial people who say, we got to be able to move fast, make decisions, not have any process. Then you add people and they're like, oh, this place is out of control. There's no process. There's no systems. And the truth is always somewhere in between. But what we've said is we're going to have one policy as long as we can, which is just do the right thing. Right. And we want to hire people who don't want to have any rules, that want to have that freedom. We try and give people responsibility and accountability, keep it that way as long as possible. So that would be what I would take. I don't ever really want to run a public company ever again.
Yeah, imagine.
you look at things like Howard Root and that guy is, he's just a terrific person. He's an entrepreneur, and like everything he went through, is ridiculous. The things like the last few years at Volcano with the threats from government relative to claims and off-label, just because it's a stick-up, to pay money to them, or having activists and investors. We've got to clean some of that stuff up to allow innovation to happen. So I don't miss that. Don't really want to do that. It's a lot of fun being at this early stage where you can create these inflection points in innovation and value creation, not only economically, but clinically.
So you grew up in Riverside, California.
I did.
Real quick, what did you want to do when you grew up?
What's that?
What did you want to do when you grew up?
Get the hell out of Riverside. I mean, come on. Nobody's been there. You've all driven through there. I mean, it's like, you got to be careful. Like I was telling these guys earlier, you got to be careful about places. They go, oh, it's an hour from the mountains. It's an hour from the beach. It's an hour from Palm Springs. I'm like, but you're there. I mean, it's like where the smog goes to die in Southern California. No, but hey, adversity is a great thing. It's the thing I worry the most about with my kids. I joke with them, they have affluenza. It's different growing up. I spent every summer having to go work on my uncle's farms in Iowa and walking beans in little towns. And, after you've seen, well, speaking back about technology, 1977, Star Wars played in that movie theater in Lamar's, Iowa, every weekend, the whole summer. So I think I saw it like 17 times. This little town of 4,000 people, but adversity's good. Yeah. And that's part of the startup thing. Overcoming adversity and making it success is a great thing.
But what did you want to be when you grew up?
Oh, it's a sad story. First, I was a horrible athlete. When I was 16, I was 5'5" and 105 pounds with red hair. And I played the accordion. Not exactly a chick magnet. That was like the poor man's piano, the accordion. But so when I was 12, I wanted to grow up and be the starting quarterback at USC and the starting point guard at UCLA. Then I found out you couldn't go to both places. And I was like, that really sucks. I was like super disappointed. But that is a serious story. But I also, a single parent family, I grew up in a bad part of Riverside. In the neighborhood I grew up in, 23 kids, 2 went to college, at least 15 went to prison, a couple for murder. My own brother and sister, don't Google too deep into my name, you'll find, prison and drugs and everything. And so I was very focused on getting out and making a difference in the world, and had a bunch of just fantastic mentors at the Y, teachers, sports coaches who showed me a way, to get out. I was fortunate enough to get a full academic scholarship to USC, and I'm full of gratitude for the opportunities. And that fuels a fire in me today to give back and to try and do things for others in the world. And it's something I've tried to impart very strongly in my kids, force them to go back to those neighborhoods and see different things. And I think that has worked. And they're very much into it. My daughter's going to UCLA Law School. She wants, to work for women's rights, and my daughter's going to med school, wants to work for, in low income areas to provide health care. And so.
And her dad's going to change the world.
Yeah, well, we all change the world, don't we? That's the great thing. We all have our portion of making that happen. That's what's very cool. Exciting about getting up every day.
That's awesome. That's very exciting. Well, Scott, thank you so much for this really fascinating discussion, and we'll catch up with you in another couple of years and find out how far along you can run.
Thank you.
Thank you very much.
Appreciate it. Thanks for the invite.